this episode 153. We're looking at the lymphatic system again, and we're going to recap what we did last week. There was obviously quite a lot to go through last week, and then we're going to start to add on some stuff as well, looking at lymphoid tissue and lymph nodes as well. Hopefully, if we get time. I was saying this might be a three-parter. As I've been going through it, it might turn into a four-parter. This might be a bit like the cranial nerves, where it goes on for a while. So if you are with us, you can make a comment, ask questions. Good morning, Tristan. Yeah, it's like spring today. It's so nice today. It's nice to have the sun out again. Yeah, cool. So without further ado, so I'm going to do like a recap of everything that we did last week, and just to kind of frame everything again, and hope, well, it may spark some questions. Lymphoid inside, exactly, mate. I think I've just been speaking to myself then. I think I pressed mute by mistake. Apologies. So yeah, but we have been focusing on the anatomy. Obviously, learn anatomy online, and it's turning into learn physiology online. So yeah, sorry about that, mate. I don't know why that happened. I think the sound. Hopefully, the sound's back now. I just saw my microphone was on mute. I was like, I'm sure I switched that on. So yeah, obviously with this particular session, it's more like learn physiology online, and obviously the A&P go together, anatomy and physiology, and understanding the structure then helps you understand the function. So that's where we are at the moment. And then as we smooth that, just lock that in place. There we go. And today, hopefully, we're going to start to have a look at this particular area. So the immune response. We should get round to that today, fingers crossed. So we're looking at different types of cells that help us fight off infection, and with obviously everything that had gone on in the last few years with COVID and everything, we started to understand a little bit more, or were presented more information on the immune system and how the immune system works, especially with coronavirus, and how they were changing the vaccine so that it presented in a different way and caught the virus, or the body was aware of the virus. So yeah, those kind of principles we're going to have a look at the beginning of that today, and then we will get to pathology. So as therapists, you probably would have heard of lymphedema. So we'll have a look at that, and you may have heard of some lymphatic cancers, so lymphoma. So we'll have a look at that too, and then clinical and lifestyle implications. So what to spot if something goes wrong, and when to refer, that kind of thing. Okay, so like I said, we're here. We're kind of knees deep in this at the moment, and then once we've got this not out of the way, but once we've got it sorted, then hopefully these sections will then start to make sense. When you're looking at body systems and you're looking at when things go wrong, you need to understand what they should be like when they're working normally, and then when you know what they're supposed to be like working normally, you can then identify when they're not working so well. Morning, Daniel. Good morning. Here's Eleanor. So hopefully you're enjoying this, Eleanor. We've got probably another couple of weeks of the lymphatic system looking at the content. It's funny, because in this book, this one, the lymphatic system is only like 4 pages, something like that, 5 pages maybe, loads of big pictures and everything, and you think, oh, that won't take long to cover, but then lo and behold, it's probably going to take some time. So yeah, if you've not seen this book before, I can't remember what edition it's on that now. I think it might be that. I think it might be the 15th edition. I think someone mentioned last week. This is the QR code that you can scan to have a look for that book on Amazon, if you want to get it. It's it like I said, it's the book that I've used all the way through my career. I've had mine for about 20 years. Good morning, David. Good morning. Right, let's get going. So yeah, quick recap of last time, and then we'll start to add some stuff in. So hopefully this will start to kind of layer the information a little bit for you. So we were looking at this last time, and we had a look at the structure of lymph. We briefly touched on lymph nodes. We're going to look at that in a bit more detail today. We largely focused on lymphatic vessels last time. So, and again, we'll recap that. So we'll have a look at the lymph flow through the system, and we will start to get onto lymphoid organs. Okay, this week that's where we are at. Yeah, so basically, lymphatic system assists in circulating body fluids and helps defend the body against disease-causing agents. So we're going to get into this bit today. So how it defends the body against disease-causing agents and what it does to protect us. So we looked last time at the three functions, and again, I went into quite a lot of detail last week. So I'm not going to go into that much detail this week on this one. Good morning, Penny. And yeah, so these are the three main functions. So we've got drain excess interstitial fluid. And again, if you've not heard of that, you didn't do last week, then have a look at last week because we went over that in a lot of detail. So fluid that's in between the tissues. It transports dietary lipids, so molecules that are too big for blood vessels, so the blood capillary network, they go into the lymphatic vessels because the gaps are a lot bigger for them to get into. Same with hormones as well. There are hormones will use the lymphatic system to circulate around the body. Carries out immune responses, so lymphatic tissue initiates highly specific responses directed against particular microbes or abnormal cells. Okay, so and again we talked about that last time, but we didn't really go into detail, so we're going to start to explore that a little bit more today as well. So that's the plan. Yeah, so lymph means clear water, and this was the lymphatic network, the kind of green vessels here. The red and the blue, obviously, capillary network, so oxygenated and deoxygenated blood. And when your body absorbs nutrients from the capillary network, so going into muscles or organs or whatever it is, there is a spillover of plasma from the blood into the interstitial spaces. Okay, so in between the tissues, and these are the bits that are full of the nutrients, which then the organ or the tissue soaks up and will use what it needs to use, and then replaces or kind of kicks back the waste products that it doesn't need. And then the waste products are then picked up, depending on what those waste products are. They go either into the lymphatic network or they go into the venal network, so towards the veins. And then they get taken either to the heart via the blood network or via the lymphatic system. Okay, so that's, and again, we covered that in a lot of detail last week, so I'm not going to labor too much on that one. So this was the flow of lymph through the body. So we've got blood capillaries into the interstitial spaces, because a lot of the blood is, I think it's 95% is plasma, it's high 90s anyway. So there's a lot of fluid in your blood, and it's that fluid that leaks out across the cell membrane walls and then goes into the interstitial spaces. And we were saying as well that depending on where the fluid is, it's given a different name. So in the blood capillaries, it's obviously part of the blood. When it's in the interstitial spaces in between the tissues, it's interstitial fluid. And then once that interstitial fluid then goes into the lymphatic network, it's then called lymph. Okay, and then it goes through various different lymphatic vessels. And we kind of got to here, we just touched on here last week. Okay, so we're going to go over this bit again, just so you understand the flow, and make sure that we get that. And that will help as well if you see anybody who has had lymph nodes removed. So if somebody's had a cancer, they're especially breast cancer, then they usually have their axillary, well, they will have their axillary lymph nodes removed. And depending on which side they're removed from will affect lymphatic flow. So we were looking at where the flow was last time. So we'll go over that again. And it gives you an understanding then of why certain areas of the body will swell up if the lymphatic system has been affected in that particular region of the body. Okay, so that again, like I say, if we know how it works normally, then we can then identify when things aren't working so well. Yeah, we've got lymphatic ducts, and then into the internal jugular vein. So that's into the venal system, or the subclavian vein. It's in the junction of the two, and then it's back into the blood network again. Okay, so once it's gone through this filtration system, then it's back into the bloodstream. Okay, so it could be carrying nutrients, could be carrying hormones, or just cleaned up lymph ready to go back as blood plasma. Okay, all cleaned up. So that's the flow. And then we were looking at the each section of the flow, and what happens in each of those points. So lymph begins as in lymphatic capillaries, so the smaller blood lymphatic network, and then we were talking about the greater permeability, so the ability of the lymphatic network to have bigger holes basically in the sides of the vessels to allow those larger molecules in. So here we go. So slightly larger in diameter than blood capillaries, and also have a one-way system. So very similar to the veins, where they've got a valve network, where they rely on. It's not like an arterial wall, which is muscular, which pumps the blood. This relies on the structures around it to squeeze the lymphatic fluid through the system. Okay, so that's what we'll have a look at. So here's your interstitial spaces. So here's a tissue cell, tissue cell, tissue cell, and then here's the interstitial fluid. Okay, this is a lymphatic capillary, and they're kind of like laid across each other like this, and then when there's a change in pressure, then there'll be a gap that forms to allow the interstitial fluid into the lymphatic vessel. Once that then gets swollen up and it fills, it then closes that cell wall, and then the movement will then push the lymphatic fluid through the system. Okay. Okay. So lymph node removal was the main reason I wanted to understand the system. Yeah, I've had clients with lymph nodes removed for breast cancer treatment and wanted to know how it affects their movement. Yeah, perfect, no problem. Yeah, so we'll definitely be going over that when we look at the clinical side of things. Yeah, no problem at all. Good morning. We've got another one coming in. Good morning, Ave. Right, let's cool. So that's your lymphatic capillaries. And we were talking about the anchors that anchor the capillaries to the surrounding tissue. So we've got this anchor filament here, and this kind of closes and opens up the valves depending on the amount of fluid that is around it. So if you imagine all around this area is just full of fluid and this has nothing in it, then the fluid will then merge into the lymphatic capillary, and then as that fills, it then pushes out against the inside walls here, which then closes up those walls, and then when you move, it will push the lymphatic fluid around. So very similar to the vein network in that respect. We also talked about this. So these were the lacteals, the lymphatic vessels specific to the small intestine. The lipids that are broken down from dietary fats, they can't get absorbed into the bloodstream because the molecules are too big. So they instead get absorbed by the lymphatic system. They get cleaned up in a lymph node just to make sure there's nothing nasty in there. And then they get carried up, and we'll look at the direction of the flow. They get carried up and then put into the bloodstream near the heart. Okay, so that's how you will receive your dietary lipids. They're called lacteals because of the color of the lymphatic fluid at that point. Because it's got fat molecules in, it turns like a milky substance. Okay, so that's why they're called lacteals. And then we had a brief look at lymph nodes. So the collection of lymphoid tissue around the body, and usually there's loads of it. So yeah, approximately 600 nodes in the body play a crucial role in the body's immune defense. Yeah, so we know that we've heard of lymph nodes before, but usually we've heard of them around here. So the neck, armpits, abdomen, and groin. Okay, so in terms of a mastectomy, so with breast tissue removal, they usually remove the axillary lymph nodes, which are the armpit lymph nodes. Okay, so what will happen then is the arm will usually swell. Okay, because there's limited drainage from the arm because of the removal of the lymph nodes. So that's why often those that have had breast cancer and breast surgery will seek lymphatic drainage type treatments because their lymph network is affected because of the removal of these nodes. Okay, and again, hopefully that will become clearer as we go through. Right. Yeah, and then we're going to cover this in a bit more detail in a second, but basically the lymph nodes will filtrate the lymphatic fluid, so it will sift through it, make sure there's nothing nasty, and then there'll be an immune response activation if there's one needed. Okay, so again, we'll go into that in a bit more detail. They are so they're fibrous capsule. And we've got lymphoid tissue that all comes together to form this node, mixed in with proteins and connective tissue. Lymph fluid enters the lymph node through afferent lymphatic vessels. And when you have a look at a node, there are several afferent vessels coming in and only one coming out. So they look a bit like a kidney shape, a bit like a spleen shape as well, really. Yeah, so you've got lots of lymphatic fluid going in, but only one coming out. So that just slows all the lymph fluid down so that lymph node can do its job, basically, and make sure there's nothing nasty coming out the other side. Okay, so it's a bit like a 5-lane motorway going into a single country road. Yeah, so you have to slow down and all kind of stack up behind each other to exit. And we'll cover that as we go through as well. Here we go. So these are the points coming in. Okay, so we've got all of these lymphatic vessels coming in and efferent vessels coming out. Well, on this picture there's two, but there are fewer. Okay, so that you have to, it slows everything down so that the filtration system through the cortex and the medulla of the lymph node, which we'll look at in a sec, can do its job. Okay, so that just a brief intro, and we'll go into that in a bit more detail. So this is where we kind of left off last week. We were looking at trunks and ducts. So we have these the trunks are nearly towards the end of the lymphatic vessels. Okay, so you'll have they've been to the lymph nodes. Okay, so if we have a look here, so we've got lymphatic capillaries. So they're your microscopic. Then we've gone into they've gone through the nodes. and now they're going into the trunks, okay, which are a bit bigger vessels. So it's all been cleaned up by that point, and then it goes into the ducts, and the ducts are up here, okay, and we'll have we briefly touched on those. We'll go into those in a bit more detail. So the ducts and the trunks. So the trunks will come from the bigger regions of the body after everything's been cleaned up, and it will put the cleaned up lymphatic fluid into the final part of the lymphatic system. Okay, so which are the ducts? So the trunks are like, if we compare it to the cardiovascular system, where we've got capillaries, if we do the arteries, arterioles, and then the arteries. So these will be more like the arteries. Okay, so going back towards the going out of the heart. Okay, probably not the best one. Probably best to use veins actually, because it's the other way around. So you got your veins and your venules and your capillaries. So the capillary network, then your venules, which are your smaller veins coming back, and then your main veins, and then like your superior vena cava, inferior vena cava. So if we relate it to that, we're at the kind of stage now where we're nearly at the superior vena cava. Okay, is that kind of size of structure? Okay, so capillary network. If we imagine these are your venules, kind of in between there, and now we're going into the veins and then the vena cava there. Okay, so that's a bit of a comparison between the lymphatic system and the cardiovascular system. So hopefully that makes it make sense. So here we go. So this is kind of where we left off. So lymph passes through lymphatic capillaries into the lymphatic vessels. As lymphatic vessels exit the lymph nodes, so where you've got all the network going in and then one or two vessels coming out in a particular region, they then unite to form lymph trunks. Okay, so and if we have a look here, we've got an intestinal trunk, so that will come obviously from all the intestines, and then the left lumbar, right lumbar trunk will gather the lymphatic fluid from the lower extremity. Okay, and we've got lymph nodes in the groin, behind the knees, down in the ankles as well. So that lymphatic fluid would have come into a lymph node, cleaned up, and then pushed back up, and then all the way up into either the left lumbar or right lumbar trunk. Okay. So the principal trunks are the lumbar, the intestine, the bronchomediastinal, which is to do with your thorax. Okay, so the thoracic region, the subclavian underneath the clavicle, and then your jugular trunks, which are to do with your head and neck. Okay, so each section of the body has different trunks, which then collect the lymphatic fluid. The lumbar trunks drain lymph from the lower limbs, the wall and viscera of the pelvis, the kidneys, the adrenal glands, and the abdominal wall. Okay, so the lumbar trunks have got a fair amount of region to clear. Okay, the intestinal trunk drains lymph from the stomach, the intestines, pancreas, spleen, and parts of the liver. So mainly the visceral organs. Okay, so that's where it's basically every part of your body is surrounded by lymphatic tissue, and it's cleaning your fluid. Okay. And then here we've got the bronchomediastinal trunk, which drains lymph from the thoracic wall, lung, and heart. Subclavian drains it from the upper limbs, and then the jugular from the head and the neck. And if we have a look here, it's the green parts on this image here. So let's have a look. Yes, we've got left thoracic duct, this one here, and then we've got jugular. That one there looks like bronchomediastinal. Yeah, that one's there. And then you've got subclavian just there. Okay, so you can see the kind of network as they go from small little capillaries into the trunks, and then into the bigger ducts, and then finally to into the blue network. Obviously, blue is veins. They obviously aren't blue in real life, but there we are. But this blood network here, again, briefly went over it last time, so just want to spend a bit more time on that. This tube here is your superior vena cava. So that is the main vein back to the heart from the upper body. Okay, so deoxygenated blood plus, now you know, lymphatic fluid from everywhere in the body. So there's no other way that the lymphatic fluid gets back into the bloodstream apart from up here. Okay, so it's all here, and then the good thing with that, or one of the reasons we think, is because of the gravity flow and the pressure in that area is quite low. So the lymphatic fluid can literally just kind of fall into the vein system and then into the heart, and then the freshly filtered fluid then gets pumped all around the body again and used as blood plasma to maintain blood pressure. Okay, so it's so that's your vena cava. This So as you look at a picture like that, this is the right side, even though it's left of the picture, and this is the left side because it's kind of flipped when you're looking at it. So you imagine that it's in your chest. So this will be your subclavian vein coming from your arm on the right side, and there's the jugular vein. Right jugular vein just there, and then this is the left side, and then left subclavian, and where those two meet. Okay, again, we did mention this before, but again, it was quite briefly. So where those two meet, we've got a jugular and subclavian junction. Okay, so the junction point of those two veins, that is where the main ducts, so the big lymphatic vessels, that's where they drain into. Okay, so we've got one on this side and then one on that side, and then you can see these green arrows now. That's the lymphatic fluid joining the vein system. Okay, so so hopefully that makes a bit more sense now. And then we started to touch on this. Just put me here. So now we're at this stage of the flow. So we're nearly finished. So here we've got lymph nodes behind the knee. So that's your popliteal. You've got your inguinal or inguinal lymph nodes in the groin area. You've got your axillary lymph nodes, and you've got your cervical lymph nodes, all submandibular, all around here. So when you're not very well, these are the areas that usually swell up, and that's your lymph nodes are fighting an infection. Okay, and they will grow in size because of the cell reproduction that is going on to fight whatever it is that has invaded your body. So usually it's here. It can be underneath the armpits, obviously, as well. It depends on where the infection is or where the infiltration of the foreign objects or foreign bodies are. They can become palpable. Usually they're not. So you usually feel the neck. So that's what I'm saying. If we know what normal is like, then we can detect abnormal. So you have a feel of your neck when you're well and you can't really feel anything and nothing's tender. Have a feel around the inguinal region, so between the pubic bone and the ASIS. Where the blood vessels pass through, that's the location of your lymph nodes. And so the lymph nodes in the groin it can be tender, can be enlarged as well. Axillary underneath the armpit, those can get enlarged too. But behind the knee, less likely, but they can do. So it's usually armpit, cervical lymph nodes, and then inguinal lymph nodes. Those are your key ones that will usually get bigger when they're fighting an infection. Okay, and again, we'll have a look at why that is in a bit more detail. So all of these little lymph nodes here, these are cleaning the fluid from either your right or left leg, and then they will then dump the lymphatic fluid into the lumbar trunks if they're from the legs, and then those lumbar trunks will take the lymphatic fluid through to this collection pouch. Okay, here. And again, mentioned this very, very briefly last week because we were running low on time. But this is the cisterna chyli. Okay, so this area here is cisterna chyli, and it's a kind of collection point for the lower body and the intestines, so all the viscera in the gut. Okay. um Good question. Are there specific medical reasons as to why it may affect different areas? Yeah, it's usually where the infections are, and also where the main collection points are as well. So the inguinal lymph nodes are the collection point for the whole leg. So if you have a problem with any part of your leg, then usually those lymph nodes are affected. Same with the arm, same with the head and neck. But it will be the cervical lymph nodes for the head and neck, as like a protection barrier, and for the arms, obviously the axillary. So it's because of the size of the region that they cover. Okay, there will be potential swellings of other areas, but it's usually those ones because of the where they go into. Okay, so where they're kind of servicing those areas. Okay, so that's the reason why. Okay, cool. So yeah, they've gone for the capillaries, into the nodes, into the trunks, and now we're for the lower body. We're in the cisterna chyli, and now we've got this really long duct. Okay, this thoracic duct. So this will travel through your diaphragm, up along your spinal column, and then it will deposit all of your lower body lymph into this left jugular subclavian join. Okay, so where they join together, and hopefully that makes a bit more sense now, because like I said, we did cover it last time, but very, very briefly. So here we are, and this was the image that you saw here. So all of the lower body, all of your left arm and the left side of your head will drain into that point there. Okay. The right arm and the right side of your head will drain into that point just there. All right. So that there's no other entrance, lymphatic entrance, for lymph fluid. It's all up here. Okay. So the junction between the subclavian vein and the jugular vein just there. Okay, so that's where it goes into at that point there. So the thoracic duct is this one here. Okay, so obviously it's collecting from the lower body all the way up, and then depositing on that left side of the vein system. And then the right lymphatic duct, which will be over here. Yeah, you can't really see it on this picture, but it was going to be a lot smaller because it only drains from the right arm and the right side of your face, and that's it. So if you have a look at this picture here, right side of face, right arm will and that region there. And I think somebody, I think it was Jane, asked a question last week about the liver on this side, so that this doesn't drain below the diaphragm. Okay, so it's only that thoracic region. Okay, and that space there. Anything below the diaphragm comes from the cisterna chyli. Okay, and we'll travel up this left duct. So the left lymphatic duct, or the thoracic duct, is between 38-45 centimeters long. Okay, so it can be the length of your spinal column. Begins as a dilation called the cisterna chyli, which is this like pouch here, anterior to the second lumbar vertebra. So that's the kind of region that it is. And if you think about other structures that are around that region as well, it's coincidence, I don't know, but that's where the conus of your spinal cord is, around L1, L2. So that's the end of your spinal cord as well. So that L1, L2 region is quite important for lymphatic and for the nervous system. So the thoracic duct is the main duct for the return of lymph to blood. Cisterna chyli receives lymph from the right and left lumbar trunks and from the intestinal trunk. So everything around this region is draining into that cisterna chyli. Okay, cool. So hopefully now that makes a bit more sense to you. In the neck, the thoracic duct also receives lymph from the left jugular, left subclavian, and left bronchiomedial sternal. So that's all this region here, all this green network here. Yeah, so that's the thoracic duct. So that line there is that bit there. Okay, so if you followed that line all the way down, then it would go down into the cisterna chyli. Yeah, so hopefully that links those two pictures. So that there is linked to this. Okay, this is coming from the head of the left side. This is coming from the arm. This is coming from the thoracic space. Okay, so all of that is draining into that side, and then right side you've got head and neck, arm, and then right side of the thoracic region. Okay, so that kind of rib cage area. Yeah, cool. That's basically where your lymph gets dumped. Okay, so the right drainage, again, we've talked about that. Right and left side, we're coming into the jugular and subclavian join. Okay, so the junction, sorry, of where they join together. And we've already talked about it as well. So you've got right subclavian vein, that one there. There's your that's your like the what's it called? There's a specific name for when they join together. I can't remember what it's called, but that will join into your superior vena cava. Okay, that point just there. So jugular, subclavian, and then the lymph from this side will then drain into that superior vena cava there. Okay, cool. Right, new stuff. How lymph is formed. We talked about. Oh no, we did talk about this. We want to know how we move, but bear with me a sec. Let's go. This is the one I want to get to. So how lymph is moved, because this is stuff we talk about all the time with, especially manual lymphatic drainage. So if you have a compromised lymphatic system, and you hear about, oh, you have to massage in a certain direction. If you have a compromised lymphatic system, then it is advisable to massage towards the heart, because you are going to the body itself is struggling to move that lymphatic fluid, because there's lymphedema. And if you push against the flow of where it's trying to get to, you're going to put undue stress on the moving of that fluid around the body. If somebody is healthy and they're fine and they've just come in with a sports massage, you can massage whichever way you want. Okay, it's not going to compromise their system, because in a healthy system, it can cope with whatever you do. Okay, so it's only really when somebody is either circulatory or lymphatic compromised that you really need to think about assisting their body in what the body is trying to do itself. So if you know that they have a problem, or you can see that there's swelling and you're thinking, blooming heck, what's that? They need a diagnosis anyway, so they need to be referred. But if they've been referred and they've come back and they've gone, yeah, we've got lymphedema, the last thing you want to do with a patient like that is, and they've got real bad swelling in their legs, is massage down their legs towards their feet. Yeah, it will increase the pressure of fluid around their feet. So you've got to be mindful in that respect. Anastomosis. Yeah, I think that's relating to the fact that you can push blood anywhere. You've got anastomoses, which are adjoining blood supply, blood networks. So it's not just like one tube and you're pushing against one tube. If you push in a certain direction and that direction is full, then the body will just send it down another tube. Yeah. But in a healthy person, there is lots of different blood networks that it can use. Like I said, healthy people, fine. People who are compromised, not so much. Good question here. How long does the process from lumbar to endpoint take? I think it's impossible to say, but it will be related to how much that person moves, and that's what we're going to go on to now. So these are the main ways in which you get lymph around your body. The manual lymphatic drainage stuff that you see will only deal with the superficial tissues. So obviously we've got drainage from the subcutaneous area, so underneath the skin, but anything deeper than that, so around skeletal muscle, around the organs, that kind of thing, the body will do its thing. Okay. And one of the best things that you can advise people to do who have a compromised lymphatic system is to move. Because the more you move, the more you activate the skeletal muscle pump, and the more you move, the higher the respiratory rate. So the more you use the respiratory pump. Okay, so if it's exactly the same as the vein system. So the milking action of the skeletal muscle contractions compresses lymphatic vessels. I think this is from a vein. Okay, but it's exactly the same for the lymph as well. So we've obviously got valves in the lymphatic system. So if you've got two muscles that are being squeezed either side, you're going to shift that lymph up. Okay, and there's no other way it's going to move. So if you just sit down all day, then you'll get swelling in the legs. Yeah, and it will accumulate in that area. Yes, you can have a massage, which will help superficially with the subcutaneous layers, but to get these deeper lymphatic vessel drainage, you need to move the limbs. Okay, and you will shift far more lymphatic fluid by getting someone, even if it's just sitting down, but just pumping their legs. Yeah, than doing a very, very light or specific massage. So that would be the goal. Obviously, some people can't do that, so there are artificial ways that you can mechanically move limbs, or use compression stockings, that kind of thing, to help with the lymphatic fluid flow. But that's a major way to get lymphatic fluid back to the jugular and subclavian veins. Then you got your respiratory pump. So as I mentioned, you got your cisterna here, and then the thoracic duct, which goes through, it pierces through your diaphragm. Yeah. So if you breathe, it's then going to compress and relax, and that will help to push the lymphatic fluid back up the thoracic duct. Yeah. So flow is maintained by pressure changes that occur during inhalation, so breathing in. The lymph flows from the abdominal region, where the pressure is higher, towards the thoracic region, where it's lower. And then when the pressure reverses during exhalation, the valve in lymphatic vessels prevents the backflow of lymph. So you get it pushed up, the valves close, the lymph stays where it is, then you take another breath in, breath out, it gets pushed up, and then it gets shunted along each time. Okay, so again, very, very similar to the vein system. When a lymphatic vessel distends, the smooth muscles in its wall contract, which help move lymph from one segment of the vessel to the next. Okay, so there is some assistance via the sympathetic nervous system as well. And so you will get some muscular activation to assist. But the respiratory pump, the skeletal muscle pump, plus the smooth muscle pump will all help shift lymph back. And that is why it's hard to say, Martin, because if you are just sitting down all day, then your lymphatic pump is going to be a lot slower than if you're very active. Okay, so one of the key things we can do is to try and get people moving. Okay, you'll get some real good success if you can do that. Cool. Right. Very quickly, lymphatic organs, and then so that's that section done. Onto lymphatic organs. Any idea of the distance between valves? I don't know off the top of my head. I'd have to have a look. Yeah, I have no idea. If it's anything like the vein system, it would depend on how big they are. So the bigger the veins, the bigger the distance. Smaller veins have got they're quite close together. So yeah, I'd have to have a look. I don't know off the top of my head, I'm afraid. So lymphatic organs and tissues are classified into two groups. This is what we're going to have a look at over the next now and then the next week. So just quickly do an intro and then we'll call it a day for today. So primary and secondary lymphatic organs. Primary lymphatic organs are sites where the stem cells divide and become immunocompetent, so they're capable of mounting an immune response. So they're from the bone marrow, the red bone marrow. So here in flat bones and then in the epiphyseal plates of the long bones of adults, so where the growth plates would have been. And we've got a stem cell that isn't differentiated. Okay, so it can become whatever you want it to be. And in terms of lymphoid tissue, in this particular example, going in this direction, the stem cell will differentiate into a lymphoid cell. And at this point, it doesn't know what it wants to be. So depending on what the body needs, it will either become a T cell or it will become a B cell. And we'll talk about what those are in a bit more detail. So these cells are formed from your bone marrow. That's where they originate. We've got pluripotent, which can become many different cells. That's what the stem cells are in the red bone marrow, give rise to mature immunocompetent B cells and to pre-T cells. Okay, so the pre-T cells will migrate to the thymus, and that's where they become immunocompetent T cells. So at the beginning, when they're first formed, the pre-T cells aren't fully functioning soldiers just yet. They have to go to the thymus to be programmed into whatever response the body has encountered before. Okay. And then when they're in the thymus, they then get programmed to whatever issues you've had in the past, whatever foreign objects, foreign bodies have been into your system. And then they get, then those T cells will then circulate around the blood looking for those pathogens. Okay. And it is like a kind of your own internal army. And sometimes though you'll get people sneak through the net, so you'll get these pathogens that come in and they'll be like, I've not seen you before, checked his ID, but he's got a fake ID, but you don't know. Yeah. So and it's only when it gets into certain parts of the lymphatic system where another like super security guard will then go, I don't recognize you and your ID is fake. And then bang. And then they then recognize that is an infiltrator, will then create a new recognition kind of it's kind of like where the coronavirus came in and it was slightly different. So it then recognizes the fact that it's different and then sends the message out to the whole body saying watch out for these guys because they're using fake IDs. Okay, and then those fake IDs are then useless because all of those cells have been programmed to pick them up. Okay, it's weird how my head works, but that's the kind of way that I think about it. Okay. Is this why stem cells transplants work? Yeah. So that there's big movements in stem cell and regenerative medicine in the States. When I was over there a couple of months ago, I went to a presentation where they are extracting stem cells from healthy adults. They're then freezing those stem cells and storing them. So if you become ill in the future, they can then use your own stem cells, re-inject them into your body to fight any kind of infection or disease that you have in later life. It's just crazy, absolutely mental. So this is the start of your immune response. Okay, so I just wanted to drop that in there. What we're going to have a look at next week is we'll do a quick recap of this. We won't recap the other bits because we've done all of that now. And then we'll have a look at the thymus and the lymph nodes and how your body spots those fake IDs. Okay, cool. Hopefully that was useful. Again, it's gone mega quick today, and without any video, just me talking. So apologies for me blabbering on. Some good questions there. If you got any other questions during the week, give us a shout. Otherwise, I will see you next Monday, 10 o'clock. See you then.